So we're going to go and get this kicked off. Thanks again for being here, and I'm going to pass it over to Annalisa.
Great, thank you. As Falani said, welcome to our annual training webinars. This is our first one of the month, and it's called Introduction to CPQCC and Friends. So we will be overviewing our CPQCC program and partners with a special focus on the NICU data center. So thank you for joining us. Next slide, please. First, we have some webinar logistics. All attendees are muted upon entry, so please use the Q&A function, and we will do our best to answer your questions during the presentation. And we also have time allotted at the end for more discussion. And we welcome your feedback and recommendations for improving future webinars, and we'll have a survey at the end for that as well. Next slide, please. We will be sharing our slides and our webinar recording after the webinar. These will be posted on our CPQCC website and our YouTube page. So if you're currently listening to this webinar in a conference room or in some other team format, please be sure to create a sign-in sheet and send it to contactmcpop@stanford.edu to be eligible for our contact hours. These hours are provided through the Mid-Coastal California Perinatal Outreach Program, and they've been approved for up to 1.5 contact hours. So to be eligible for those, please remain on the webinar the entire time, and please also complete our webinar survey, which will be available immediately following this webinar and is open to everyone. So we appreciate your feedback. Next slide. My name is Annalisa Watson. I'm a program manager of the NICU Data Center here at CPQCC. And in speaker order, I'm joined by Dr. Profit, our co-chair and co-principal investigator of CPQCC, Falani Davis, our NICU Data Center lead program manager, and Courtney Bro, our associate director of quality. Next slide. Great, so this is our agenda for this webinar, and we're really excited to get started. So I'll be passing it off to Dr. Profit for an overview of CPQCC mission and goals. Next slide.
Yeah, thank you, Annalisa and Falani, for putting this this whole training together and for everything you do with the data center. And I think everybody who's probably here on the call knows you work very intimately. So I just wanted to take the moment to just express my gratitude towards all the things you do. Next slide, please. All right, so this is our mission. Really hasn't changed in a while. So we're a statewide network of NICUs in California and high-risk and follow-up clinic. It's like really important to know that we have there's I think over 70 actually high-risk and follow-up clinics in the state, and we're like the only state that really has like such a statewide network. And then have the ability to really capture data not just during the NICU stay, but also after baby go home and for the first 3 years of life. So it's really fantastic. Our mission is to improve the quality and equity of care for California's most vulnerable infants and their families. And we really do this from birth to the NICU stay, but then through high-risk and follow-up through early childhood. And it's actually a theme that was kind of spearheaded by Jeffrey Horbar of the Vermont-Oxford Network, where he said like we shouldn't just kind of follow up with our patients, but we should follow through. And I think that's a theme that we've been trying to hold up also with the upcoming Care Collaborative that maybe Courtney might be speaking to a little later, where we're really trying to focus on screening for things like social determinants of health and making sure that babies, when we discharge them, are discharged home in a safe manner and with all the needs that the family may need to support their infant. So next slide, please. As an organization, we've really had like amazing impact. I think CPQCC and CMQCC on the maternal side, we've really been leading the nation with regard to improvement work, clinical improvement, and outcomes for our patients. And there's a couple of couple of statistics here from our annual report that you can see here with the QR code. If you have a chance, if you haven't seen it, take a look. It really is just a wonderful kind of summary of all the things that are happening, and you'll see there's a lot happening across these organizations. So it's a really great, we've been one of the only states, maybe actually the only state. It was a couple of years ago when CDC data was still very accurate. We'll see if it continues to be that way. Well, we were the only state in the nation that reduced perinatal mortality, and we've specifically reduced neonatal mortality in California. So it's a huge thing. We've decreased things like severe intraventricular hemorrhage. We've reduced things like necrotizing enterocolitis by almost 50%, infections by almost 50%, discharge of babies, VLBW babies home with multiple major morbidities is down by over 40%. So, those are amazing successes that have been leading the country, and I think we can be very, very proud of these. Similarly, on the maternal side, there's been, and you probably all heard that there's been a maternal mortality crisis, morbidity crisis, sort of across the country. Actually, like California has substantially reduced maternal mortality, and actually the next state after California has a 50% higher maternal mortality rate than what we have. So just like a moment just to be proud of the work that we have done with, and it's not us, right? It's like really you, it's the hospitals who have been doing this work, and really all of our work kind of comes back to data, and I'll talk just a bit more about that. So your work that you're putting in there is having real impact and is creating real results. So thank you. Next slide. So these are kind of the things that we do, some of our major activities, benchmarking, the data needs to come in, otherwise we don't know how we're doing. In the hospitals, we love to compare ourselves against our peers. So we're competitive people, like to make it here. We don't want to look bad compared to our peers, and so we try to be better. So benchmarking is really a key part of what we do. We do use our data for many other reasons, not just comparisons, but we want to figure out whether things are getting better. And so we need to do some research, or we need to figure out why things are not good. So some of the data is being used for research to try to then inform quality improvement efforts. We use these insights to provide education around the state. And ultimately, of course, like we want to really leverage all of these data insights and use them for quality improvement to then improve the care for our patients. Next slide. All right, let's talk a bit about benchmarking. Next slide. So like our CPQCC reports, they're informed by what you do. Like if you don't know where you are, like we try to, if you're like on this boat and you're in the middle of the ocean and, maybe it's foggy and everything, you just don't, like maybe your babies are doing well, maybe they're not doing well. It seems like all of our staff is like motivated and expert and like they should be doing well, but how do you know, right? It's like when you go and see a doctor, like how do you know if you're doing well? Because you got somebody's recommendation. Okay, maybe that's a bit of a data point, but we'll actually have like real data thanks to you to kind of show you how you're doing and where you're going. And it's so key to like look at this data routinely and popularize it and democratize it so that like many people in your unit know how you're doing and where you're going. So thank you. Next slide. So you all help us to get the data, and then that's really it's a key step, right? But we have to turn that data into information by curating the data, making sure we compare hospitals that are similar to each other and not like widely divergent populations. So we do a lot of kind of mathematical adjustments to try to figure out how do we really like compare oranges with oranges, not apples with oranges. And then that's not like this information is great, but that's not enough. We really need to use that information and then turn it into action. Some of that we help your hospitals with through our collaboratives and our toolkits, and the many people who participate and volunteer for us to kind of spread that information, spread potentially better practices. But a lot of it you guys do like internally, right? Like by just looking at the reports, figuring out where's an opportunity for improvement, and then just pursuing that. So next slide. Okay, next. So just like really, like these are just a few highlights, and I thought I just show some of these, like some of the slides are like small to see, but I just wanted to kind of highlight some of the work that's been done through our collaboratives. So this is our GAIN collaborative that focused on surgical patients, and really here the idea was to, can we figure out a way to sort of standardize care after surgery with regard to nutrition to allow these babies to grow better. And so like it's like very, very nice collaborative. We had never done one before just for surgical patients. So, collaboration with surgeons and neonatologists and nutritionists and many different contributors, figuring out how to kind of standardize post-op care. And like on this, can you guys see my little arrow? I'm not quite sure if you can see it because I'm not sharing the slides, right? Maybe you can't. Do you know, Annalisa or Falani?
We can't see that, sorry.
You cannot, right? Okay. So, but on figure A, essentially, you can kind of see how like really like a lot of the units became like very like standardized with regard to using TPN optimization after surgery. And so, these are the kind of interventions that we promote to improve the care of the babies in the unit. And so it's a nice publication, and it was a terrific collaborative. And so just wanted to highlight that. Next slide. And these are all just examples. We publish about maybe 25 to 30 manuscripts a year from our work, and we're always open to collaboration. If you have folks at your hospitals that want to collaborate with us, that have a clinical question, they want to turn into a research question, like we stand ready to like help you and work with you. And please contact us. This is a paper from Dr. Schulman from CCS at the state. He also works with us, and he's interested in what we call these LANA babies, essentially like low acuity admission babies to the NICU, of which there's a lot. Like actually the vast majority of babies in the NICU tend to be kind of low admission. And what these kind of graphs kind of show you is just sort of the variation across hospitals with regard to whether or not these babies get admitted. And so that's kind of interesting. There's many different reasons for this variation. So a lot more work to be done, but this is the all infant admit database, and just like I thought I'd show you that some of this data collection is actually also leading to insights. And so here, like wide variation across the state with regard to whether or not these low acuity infants are being admitted. Next slide. Here, like when you look at like figure A here, over the years, actually there's been kind of a nice convergence here across the years from 28 to 2021 in all these different lines of different race ethnicities. And you can kind of see that the difference here at the beginning in 2028 was pretty large, but then it's really kind of converged sort of more on the, more recently. And so this is kind of, we'd also want everybody to get better. So what we're striving for is everybody get better. Everybody survives without major morbidity, which, and things have been getting better, but we also want the disparity get smaller, which it also has. So that's a really nice thing to see. It's not all perfect in that when you look at safety net hospitals, which is why I kind of mentioned the safety net hospitals, you can kind of see like non-safety net hospitals have been pretty steady for a number of years. The safety net hospitals seem to get better, seem to catch up. But over the last couple of years here, like there's been sort of a regression. And so hopefully, like in part, our care collaborative will help with this. Next slide. Okay, and so just to finish up the research, like more than 100, probably more than 150 or 160 papers or so have been like have come out of CPQCC, kind of contributing to the general literature on quality improvement and epidemiology and things like that to figure out like how to help babies, and it's being widely used by other states as well, like following our lead. So thank you. Next slide. So this collaborative is focusing on breast milk feeding in safety net hospitals, and as you can see, there is sort of this disparity with regard to breast milk feeding rates. The dotted line on the bottom is the safety net hospitals, and the solid line on the top is the non-safety net hospitals. And those are defined, by the way, by having a share of more than 2/3 Medicaid patients. And so because of this difference, and because the hospitals told us they wanted to focus on breast milk feeding, we conducted this, or have been conducting, and are sort of at the tail end of the Moms Collaborative here. And so next slide. And so this is really cool data. So like from the baseline of 65% where we started, and as you can see here, so the data, this is like the magic that like, data entry and data provision can kind of show us. We can kind of see how we were going over time in this graph. And then like the whiter parts on the top, like this is the learning session 1 and 2 and 3. And you can kind of see like the results are kind of marching upwards here, and we ended up from the beginning at 65%, now like up to 83%, and 83% is really like much higher than even our non-safety net hospitals are achieving. So this is really terrific, and we're not quite done yet. There's still data coming in, so it's still ongoing, and like please don't publish this data anywhere yet. It's still preliminary, but like I think can all be very proud of this work. And Courtney, of course, has been leading a lot of this, which has been fantastic. Yeah. So
Thank you, Jochen. We
thank
really
you.
appreciate your time.
Right. Yes, sorry I've been like, it's been a whirlwind of a morning, but like
No
I hope I could
problem.
show you a little bit of an introduction here and the kind of things that we do, and like really thank you, all of you, for being a part of this and making this magic happen. That's really we're a unique state, and you're all a part of like just like really unique work. So thank you.
Great. Next slide, please. Oh, one more back. Thank you. Okay, so this is our continuum of care structure. We're really proud of this. We feel it's unique to California. Our data at CP and CMQCC encompass the entire perinatal journey, beginning with pregnancy, labor, and delivery through the maternal data center at CMQCC. And we track all NICU admissions on the CPQCC side. And we have a particular focus, as many of you know, on the higher acuity cases. But our database also includes neonatal transport information and the option to collect data related to maternal substance exposures. And then furthermore, we monitor the care provided to these infants as they become eligible for high-risk infant follow-up. Next slide, please. So to put this data in perspective, we have our finalized totals from 2024 data finalization. You all are managing an impressive volume of data every year. Our partners at CMQCC provisionally have tracked approximately 394,000 births, and CPQCC recorded about 18,000 higher acuity admissions in the NICU in 2024, while the overall NICU admissions totaled to approximately 50,000. Last year, CPQCC had 135 member hospitals, and CMQCC served almost 200 birthing hospitals. Additionally, the California Perinatal Transport System documented over 5,000 acute neonatal transports, specifically for medical or surgical care at higher level hospitals. And lastly, we have registered approximately 9,000 infants in the high-risk infant follow-up program. So these figures highlight the significant impact and breadth of our work in perinatal and neonatal care. Next slide, please. We wanted to take a moment to celebrate our incredible teams at CM and CPQCC. This photo showcases many of our dedicated professionals whose expertise drives improvements in maternal, perinatal, and neonatal care. Many of our team members bring extensive experience in quality improvement initiatives and clinical practice and data analysis, which all offer valuable insights. So thank you to our team for your ongoing commitment and collaboration. Next slide. We wanted to present a closer look at CMQCC, our sister organization. Their mission is very similar to eliminate preventable morbidity, mortality, and racial disparities in maternity care. Founded in 2006, CMQCC functions as a multi-stakeholder collaborative with a strong focus on supporting hospital members. And similar to us, they offer programs and tools that empower hospitals to carry out effective QI initiatives. They have a commitment to evidence-based care, data-driven QI, and they ensure that their efforts are both impactful and sustainable, driving meaningful improvements in maternity care across the state. Next slide. CMQCC works closely with a wide range of stakeholders, including state agencies, professional organizations, community groups, and key leaders. This collaborative approach enables a comprehensive effort to improve maternal health outcomes and address the diverse needs of communities throughout California. Next slide. We also wanted to highlight the Maternal Data Center, which is the key tool developed by CMQCC in 2012 to support hospital quality improvement. The Maternal Data Center harnesses existing data sources to provide rapid cycle metrics and performance reporting. Its key features include an intuitive interface, aligned measures for performance tracking, exceptional customer service, and together these features make the MDC an essential resource for advancing the quality of maternal care. And building on this, the MDC now includes the HCHI Hospital Equity Measures Report. So this feature allows California hospitals to download data extracts aligned with HCHI reporting requirements, which streamline reporting and reduce the effort needed to comply with the state mandate. Next slide. The Maternal Data Center is also growing, which is very exciting. So obviously they're primarily focused in California, and they track an impressive 98% of the state's deliveries, but they've also expanded into additional states, including Washington, Alaska, Montana, Oregon, Hawaii, New Mexico, and Texas. So this expansion now covers roughly 13% of births nationally, which significantly increased CMQCC's ability to drive improvements in maternal care on a broader scale. Next slide. And then, of course, like CPQCC, CMQCC does fantastic quality improvement work, and it's worth highlighting the many QI collaboratives that they've led. And we don't have time today to cover every initiative in detail, but they also have a variety of QI toolkits, which are available on their website here. You do need a CMQCC account to access them, but once you get one, they're widely available. And these resources are designed to help hospitals and healthcare providers implement effective evidence-based quality improvement initiatives. Next slide. Finally, kind of in the maternal realm, we have a quick look at impact and trends. This figure, taken from the California Department of Public Health's Pregnancy Mortality Surveillance System, highlights the trends in maternal mortality ratios. And while California's MMR reached its lowest point in 2016, it has increased again through 2019, contrasting with the rising national trend. California's pregnancy-related mortality ratio remains significantly lower than the national rate, showcasing the impacts of initiatives like those from CMQCC. And the statistical significance of these trends emphasizes the importance of ongoing quality improvement efforts in maternal care. So now I'll pass the presentation for Fulani for an in-depth overview of CPQCC's NICU Data Center.
Great, thank you, Annalisa. Next slide. So thank you again for sharing the overview of the CMQCC Maternal Data Center. As many of you can probably see, there is a partnership between CPQCC and CMQCC. So though we manage separate data systems, we share the same mission to improve perinatal care in California. Which brings us to the next focus of our continuum of care structure, the NICU Data Center and the infants who require intensive care after birth. But before we get into that, let me first introduce the team that works behind CPQCC. Next slide. So here's a CPQCC team, the people behind the data, our leadership, our staff, our clinical experts who keep the systems running, support our NICUs across the state, and guide the quality improvement work that flows from the data. Next slide. So now that you've seen the people behind the work, let's look at who's in front of it. And that's really all of you, as Dr. Prophet mentioned earlier. About 80% of our California's NICUs are members of CPQCC. And here you can see it's broken down by CCS level and the perinatal region. But overall, we've got a pretty nice mix of membership hospitals that are all over the state. Next slide. Okay, so now we're going to take a closer look at the data and what our members can gain from it. Our database began with the higher acuity population, the smallest infants born very early or weighing less than 1,500 grams. And then we have larger babies that meet specific clinical criteria. This has always been the foundation of CPQCC's work that continues to drive benchmarking and statewide improvement. And if you'd like to learn more about that, more about our current eligibility criteria, you can access it from our website. And you can see that in the screenshot to the right. Next slide. Okay, so now we're going to talk about how we actually capture these infants. So we use 3 required forms: the admission and discharge form, the transport form, and the delivery room death form. So together, they give us a clear picture of how high-risk infants enter the NICU, how they move between hospitals, and what happens during those critical first hours of delivery. Again, to the right, you'll see a screenshot of our website where you can review and download these forms for internal use. In addition to the core elements, some centers also like to choose to collect more detail. Next slide. And some of that detail comes from our optional items that we offer in the higher acuity database, which can, in some cases, can make the data set richer. So these items include the delivery room oxygen, or family-centered care measures, such as when these infants receive their first skin-to-skin, their first colostrum, and even contact with a social worker. So this takes care beyond just the outcomes and helps capture a bit of the NICU family experience as well. As a heads up, we do have some updates that regarding the family center care items, and we'll cover that in the NICU data webinar. Next slide. Okay, so over time, we've expanded the system to make data entry and analysis easier and more efficient. The NICU database is flexible, but it's also really powerful with the features and the tools that can be used for data quality, not just data reporting. So for instance, the HRIF linkage that ties neonatal records to follow-up data, the data consistency report that flags duplicate entries and inconsistencies between NICUs, or the data sharing tool that allows 2 or more NICUs to see and share data items on transported infants. And these are just a few of the many tools and features that really enhances the user experience, but more importantly, increases the data quality, the quality of the data that you're working with. So as the database grew, we also recognized that we needed to capture more than just the higher acuity infants. We needed to expand that to all NICU admissions. Next slide. So that's why we created the All NICU Admits database a few years ago, probably over a decade now, which includes every infant that's admitted to the NICU, regardless of condition. This provides a complete picture of your NICU care, and it streamlines with the CCS reporting and links seamlessly with higher acuity forms. The eligibility criteria for the All NICU Admits database is simple. If a baby is admitted to the NICU, they're eligible. There's no additional criteria. So this straightforward approach really ensures that we capture the full scope of the neonatal care across the state and in each of your individual NICUs as well. Next slide. So of course, the real value of data lies in what our members can learn from it. And our reporting system provides that value. Hospitals have real-time access to reports like the NICU dashboard, the baby monitor, control charts, focus boards, which allows teams to track measures on maternal exposures and family-centered care and the all NICU admissions, like I just mentioned. These reports turn your raw data into actionable insights that can be seen from the NICU level, the region level, and even your own systems level. So you'll learn more about some of these during the upcoming NICU data webinar. But if you'd prefer not to wait until then, you have a couple of other options. Next slide. So one of those options is you can visit our NICU reports page on our website to find videos and learn more about the dashboards, the control charts, the tables, and the baby monitor. You can see how to get there in that graphic to the right. Next slide. Or if you're interested in visiting our CPQCC's YouTube channel, we have a playlist from last year where Dr. Profit really dug deep and demoed many of these reports listed in the previous slide and what's new with NICU data session, as you can see there on the screenshot. So we do invite you back in 2 weeks to learn more, but if you'd like to take a look at these in the meantime, we invite you to do that as well. Next slide. So now I want to round this all out with a flow chart that you may have seen before to help you understand how this all works. This high-level breakdown starts with all of you, our CPQCC members, who submit this valuable data to us. All the valuable data that is stored in the NICU database is analyzed as outcomes and process measures for you and through our NICU report system, and then finally cleaned and packaged for further work in various projects. So we do our best as program managers to give you valuable customer service on the front end through our help desk, through data reviews, through technical support, and tools for data cleaning, while our biostats further analyze and prepare that data on the back end. So this entire process really produces high quality data for reports, your internal QI projects, the collaboratives that you'll hear about soon, and research. Next slide. And we also have many resources, some which are highlighted here, the most important being the help desk, as I mentioned before, because it's usually where communication starts with us, and it's what you'll use to submit any questions or concerns regarding data entry, reports, eligibility, or just general questions about the CPQCC program. Outside of the help desk, we offer other types of resources, such as one-on-one support, webinars like the one you're attending today, and data applications that enhance and improve the process of your data entry, your data tracking, and your data reporting. Next slide. But the data center is more than just a resource, it's also a community. We do our best to bring users together through committees and mentorship. The Data Committee Advisory Group, it helps guide our improvements, while the Data Mentorship Program pairs experienced users with newer ones. And each year we recognize NICUs that meet deadlines and demonstrate excellence in data management. It's, a small way that we can recognize each one of you for all the work that you've done and the overall value that you bring to CPQCC. So together, the higher acuity database, the all NICU admits database, the reporting tools and the features provide a statewide picture of NICU care. But as you know, infants
Looks like Falani froze on my end.
don't always get where they're born. The next part is continual receiving transport through this California periodical transfer system, CPAS. Oh, did you guys lose me for a minute? I'm sorry.
That's okay. I think we're ready to move forward onto CPETs. Okay, perfect. Next slide, please. So Fulani was closing out kind of the data center and relating that to your transport system. So the state of California mandates that the California Perinatal Transport System, or CPETS, to streamline perinatal transports and track bed availability for the neonatal and the high-risk maternal care, promoting effective perinatal regionalization. So this process is supported by the perinatal.org website, which offers 24/7 bed availability as well as facility contact information. CPETS generally operates across 2 regions. We have North and South, and includes a data system within our NICU data center with standardized reports to inform quality improvement initiatives. Next slide. So the data collection for CPETS began in 2007, averaging over 5,000 records per year over the last 5 years. And this data is collected in the field using the CPETS Acute Interfacility Transport Form, which is entered into our NICU database. So each year, standardized reports are generated and provided to each hospital to support their quality improvement efforts when it comes to transport. Next slide. There are key challenges in perinatal transport, including underutilization, delays, and time intervals in the transport process. So our data collection and reports aim to support these challenges, and teams can access this information in our NICU reports database. Unfortunately, our CPETS webinar was canceled this year, but any relevant announcements related to CPETS will be shared at our What's New with NICU webinar, which is in 2 weeks on Wednesday, October 15th. Next slide. Next, we wanted to give a brief highlight to our partner, RPPC. Next slide, please. The Regional Perinatal Programs of California, or RPPC, is a cornerstone of California's community-based perinatal health system. This system includes the Comprehensive Perinatal Services Program, RPPC, as well as local Title 19 efforts. Together, they support prenatal delivery, postpartum, neonatal, and infant care services, which have proven effective in reducing maternal and infant mortality and morbidity. RPPC was established in 1979 to address the need for a coordinated, cooperative network of public and private healthcare providers. And by fostering collaboration within specific regions, RPPC ensures pregnant women and their babies receive appropriate, high-quality care. And over time, it has also become a resource for quality improvement, offering consultation and technical assistance to hospitals and healthcare providers. Next slide. Okay. So continuing with our unique care structure, we've kind of gone all the way around this arc here. And lastly, we wanted to overview the high-risk infant follow-up reporting system, which we manage in partnership with California Children's Services, or CCS. This program oversees outpatient follow-up of infants requiring additional developmental care after NICU discharge. Next slide. So there are currently 67 HRIF clinics across California, along with 12 satellite clinics. These clinics play a crucial role in providing ongoing care and support to high-risk infants. And by offering specialized follow-up services, these clinics ensure that infants receive the necessary assessments and interventions to promote their healthy development. The satellite clinics extend this vital support to more remote areas, making it easier for families to access essential healthcare services for their children. Next slide. HRIF serves infants with special medical eligibility criteria, including all infants born before 32 weeks of gestation or with a birth weight less than 1,500 grams, as well as infants with a range of neurologic and/or cardiovascular risk factors. Next slide. Each infant is provided with 3 standard visits, and in addition to these, CCS may cover additional visits if deemed necessary by the HRIF team. So this approach ensures that each infant receives the appropriate level of care based on their individual needs. Next slide. HRIF visit goes beyond neurodevelopmental assessments and considers hospitalizations, surgeries, as well as medications. They track data on infants receiving medical and special services and any gaps related to these. Additionally, key programs like Early Start and the medical therapy program support these efforts, and they also address parent concerns regarding living arrangements, caregiver issues, language barriers, and socioeconomic stressors. Next slide. Since the launch of the HRIF database in 2010, 134,800 infants have been identified and referred to the HRIF program, and 46% of these qualified as a very low birth weight infant, and close to 200,000 standard visits have been performed. Next slide. So the HRIF data flow is very similar to the NICU data center. The CCS NICUs and HRIF programs enter data into the HRIF reporting system, and then this data is used to generate site-specific reports and dashboards. And then on the back end, our biostatistics team analyzes that data to support HRIF programs, as well as CPQCC-led projects, and then ongoing reporting system improvements. Next slide. NICU teams can request access to the HRIF reporting system. This will streamline patient referrals and access to NICU summaries and reports. So to get started, please submit a help desk ticket at cpqcchelp.org. Next slide. Once you have an account, you can access the HRIF database from our website. Next slide. And once you log in, you'll see the NICU referral dashboard, which was launched this July. This dashboard enhances the NICU referring process, record tracking, and monitors timely patient referrals. We always get asked the definition of the timely referral registration, and that is defined as eligible infants enrolled into the HRIF reporting system within 60 days of home discharge from the reporting CCS NICU. Next slide. You can explore referrals in more detail using the NICU referral dashboard. So here are a couple charts displayed in the dashboard that show a NICU's referral and registration status by month, as well as their patient follow-up rates to the first standard visit by birth year. Next slide. Another available dashboard is the HRIF Healthcare Access Dashboard. This provides site-specific outcomes based on social factors like race and ethnicity, primary language, and medical coverage. By examining data through various visualizations, we can assess whether there are differences in outcomes among different patient groups. And so the goal for this is to identify any disparities and track if these factors are improving over time to ensure that we are advancing equity in patient care access. Next slide. For members who are interested in accessing the HRIF system, but don't yet have an account, you're able to preview available reports through a demo data set, which is available on the HRIF sample app on the CPQCC website. Next slide. Lastly, we just wanted to call out the HRIF data resources page if you want to learn more about these resources. And then, of course, there will be a deeper dive about HRIF in our final data training webinar on Wednesday, October 22nd with Erica Gray, the program manager of HRIF, and Dr. Susan Hintz. They'll be presenting what's new with HRIF, and that presentation always has great reviews, so we know you're going to enjoy it. Okay, next slide, please. So we've overviewed a lot of our programs within CPQCC, our partners at CMQCC and beyond, and you all know that we collect a lot of data. So we wanted to ask, has this work made a difference? Next slide, please. So if you've been involved with CPQCC for a while, you've probably seen this graphic we generated back in 2008, and it's been on our website for many years, or it was, which shows that yes, this work has made a significant difference. Next slide, please. We've run these numbers, longitudinally again and again. These are some impact figures from our 2008 to 2017 analysis that show additional improvement, including additional reduced mortality rates by 15%, an additional 9% of babies discharged without major morbidities, and the rate of NEC being decreased by 45%, among other achievements. Next slide. We also ran these numbers again this time last year. The range was from 2014 to 2023. And while our improvement is less substantial, there are certainly noticeable reductions, such as a 13% decrease in severe intraventricular hemorrhage, 8% reduction in neonatal mortality, and a 6% decrease in retinopathy of prematurity. Next slide. So lastly, here we have some recent quality improvement impacts through a few different collaboratives that we've had over the last few years. Through the collaborative Grow Baby Grow, we've successfully reduced rates of growth restriction and malnutrition in very low birth weight infants and those collaborative participants, supporting better overall outcomes. And in small NICUs that participated, we've seen a 42% decrease in inadequate growth among late preterm infants through the Growth Advancement in the NICU Initiative, or GAIN. And then in the NeoBrain program, the percentage of very low birth weight infants receiving daily positive touch from their care team increased from 44% to 83%, which shows a huge improvement in care. At CPQCC, we truly believe that engaging in QI collaboratives helps teams share insights, adopt best practices, and contribute to meaningful improvements in infant care. So with that, I'll pass the conversation to our Associate Director of Quality, Courtney Bro, to share more information about CPQCC's quality improvement activities from over the last year and beyond.
Thank you, Annalisa. Good afternoon, everyone. I'm so honored to be here with you today, and I see a lot of familiar names on the Zoom, which makes me smile. So thank you all for joining us. And as you heard from our wonderful team, Jochen, Falani, and Annalisa, next slide. I'm so sorry. There we go. As you heard over the past, 48 minutes, at CPQCC, our commitment has always been about more than just collecting data. It's about turning that data into meaningful action, and that in turn transforms care for all of our patients and families throughout the state. So I'm going to highlight how we do that, and that's through our expertise, through partnerships, through equity-centered improvement work, and the incredible efforts of NICUs like yours across the state. Next slide. So just an overview, you heard this before, but these are really our CPQCC and CMQCC areas of expertise. And we bring together these 5 interconnected strengths around community and family partnerships. Families are at the center of everything we do. And the reach to community is critical in supporting families, especially with their transition to home. The data, we have one of the richest statewide neonatal data resources in the country. This is amazing. Quality improvement, we've developed and leveraged proven QI frameworks and structures to help NICUs like yours move this data to change and create change. Education, building QI skills and capacity across all NICU teams is a priority. And with our research, we translate evidence into practice and then practice back into evidence. Next slide. So our framework at CPQCC is equity-focused QI, and it's our guiding principle that equity is not separate from quality. It's the foundation of quality. So we disaggregate data to uncover disparities, embed equity checks into quality improvement, and intentionally partner with families so lived experience shapes improvement. This really truly ensures that every baby and family benefits from our work. Next slide. You heard a little bit about partnerships, and this is just a reminder that partnerships is what makes this work possible, period. We collaborate not only with CMQCC, but state agencies, health plans, and community-based organizations, and that really allows us to expand our reach and impact throughout the state and beyond. Next slide. I'm really excited to highlight the members of our perinatal quality improvement panel, which is PQIP. So PQIP truly brings together diverse voices from throughout the state. There's clinicians, families, and community partners that really guide our priorities and ensure our work reflects the needs of NICUs across the state. Next slide. So how do we do this with equity-focused QI? I'm going to dive deep around these different areas, but specifically around improvement palooza. Next slide. Many of you have probably seen this slide before, but this is truly for years how our annual improvement palooza has been a hub for advancing equity in the NICU. So our improvement paloozas really highlight best practices, we foster innovation, and we showcase how equity-centered teamwork can really help and be scaled across NICUs. Next slide. I'm really excited to highlight our improvement palooza for 2026, where we're really looking ahead. You can register now. It's on March 18th. I know that our PQIP Ed and Outreach Chair is on, Tanya Hatfield. Thank you for your support in planning this. And we're really excited to have a space to continue building momentum, sharing lessons, and also setting the stage for the next phase of neonatal improvement. So register now, and it's in San Diego at a new location. Thanks, Annalisa, for popping that in the chat. We really can't wait to be together and continue the great work that we've done over the years. Thank you. Next slide. So I'm going to dive down a little bit around our QI collaboratives. Next slide. So what is continuous quality improvement? So QI isn't a one-time effort. It's continuous. We support all of our NICUs in building improvement into daily practice, sustaining the gains, and tackling these new challenges as they emerge. Next slide. There are a lot of advantages of quality improvement and the value of how you all collaborate with each other. So the value of collaborating across NICUs is immense. There's benchmarking, there's shared learning and peer support, and those really help accelerate progress in ways no single NICU could achieve alone. Next slide. Our framework is really grounded in the IHI, the Institute for Healthcare Improvements Model for Improvement. And really, we are indebted to this framework, if you will, with each collaborative that we run. We always ask what we're trying to accomplish, how we'll know change is important, and then what changes we can test. So it's a simple, practical, and effective way to implement change in very busy NICUs. Next slide. So it's hard to believe when I put this slide together that we've had 17 years of improvement. We're so proud that we've been running collaboratives for this long, and we're continually learning, refining, and scaling to see really what works best for you. You can see the myriad of different topics through the years, and we're really proud to announce that over 79% of CPQCC member hospitals have participated in at least one quality improvement collaborative over time. Next slide. What is the mission of these collaboratives? So it's clear, it's really to improve outcomes, strengthen NICU teams, and advanced family-centered care. We also embed equity into every aspect of improvement. Next slide. So I know Jochen highlighted the Moms Collaborative earlier. So it's motivating and optimizing maternal milk in safety net NICU. So this is our active collaborative right now, and it's an NIH grant-funded project. And we were able to really engage many NICUs that previously were not able to participate in collaboratives due to barriers like funding. Next slide. Here's our faculty panel. They drive this work. They're amazing. It's multidisciplinary. We have stakeholders from not only within California, but outside of California. Next slide. So here's our schematic in terms of where we're at. And we're really, past our final learning session phase over to the right there in June. But you can see all of the resources and supports these teams have had. This Moms Collaborative really has been an exciting effort. And really, these teams have driven improvement, maternal milk optimization, reducing disparities, and increasing family engagement. Teams have really piloted creative solutions, tested new change ideas, and then built stronger connections with families. And really, this focus on improvement is really a dyad of maternal and infant health together. Next slide. So we have 25 safety net NICUs participating, and you can see that this improvement is real. So these rates of human milk at discharge, as Jochen mentioned, from 65% to 83% post-learning session number 3, and still climbing, is pretty incredible. So I want to applaud and recognize these teams that have really dedicated they have been dedicated to this work and have really marched forward with teamwork, family-centered care, and equity, and all that they've done. We've had 3 learning sessions in person. It's been remarkable to be able to see the transformation in this community of learning that has evolved. Next slide. Most importantly, though, are the family leads that have been critical to this collaborative. Each individual NICU has a family lead representative that is part of their QI team. And so here is a NICU resource that they developed around supporting lactation in the NICU. So this is available to all, and it was most recently highlighted in our newsletter at the end of the, I think at the beginning of the month here of last month of September. So if we need to distribute this, oh, Annalisa's on it. Thank you, Annalisa. Here's the YouTube video. Please share that. Share that with your colleagues, but most importantly, it's a tool to support our families as they move through the NICU, especially around lactation. So kudos to our wonderful producers here of this video. And we're really, really proud to be able to partner with our families in this way, and they're leading the way. So thank you. Next slide. Next up is our upcoming collaborative, Collaborating for Access and Resources in Early Life Care. Next slide. So for once, with a collaborative, we are focusing on all NICU babies. We've never done that before. We've always had a subset of the NICU population that we focused on. And with this collaborative, we're really taking on health-related social needs in the NICU. So we're looking at screening, we're looking at referral, and then the important connection to services. It's one of the first initiatives of its kind in this country throughout, all NICUs, and we're following on the heels of Boston and Massachusetts, where they have done great work around this in tracking. Next slide. Here's our timeline. We are currently in our register or in our enrollment phase. So we are accepting registrations through July or through January. We have decided to open that up in terms of expanding our timeline, because we really want to give NICUs the opportunity to talk meaningfully with their administrative team. We have tools on our care website that you can download, pitches, executive pitches, which really highlight the importance of why we need to do this, right? We're highlighting the importance of this bi-directional development or information flow around collaboration with various stakeholders. So this includes managed care plans. This includes community partners. And we really are looking to optimize care transitions and ensure that families receive the support that they need when they transition to home. Next slide. Here's our collaborative planning team. Again, these are experts and stakeholders from throughout the state that really are driving how this collaborative is structured. We don't do this alone. We leverage the voices of many, and just wanted to highlight and thank all of these individuals. And it's growing. I feel like every day we turn around, we have more people that we're collaborating with, which is just a beautiful and wonderful way to move forward. Next slide. Here's our SMART aims. Oftentimes, we're not able to share our SMART aims ahead of our learning session kickoffs or the collaborative kickoff. So just wanting you all to see exactly what we're trying to do here. We're looking at screening, and those that do screen positive for at least one health-related social need, we want to make sure that they have a high-quality referral. There's a definition. Really, our goal is the right service, the right fit, the right time, and the right way, with families at the center. There's a sub-aim, because we understand that the enhanced care management has a lot of opportunities for our Medi-Cal patients, and being able to connect them to the community in a really appropriate way. A lot of these services in the community are not really being utilized. So let's utilize them so that we can support our families in the best way that we can. And then the other SMART aim is really making sure that we have a successful and active connection for those services, for those patients that were referred. Next slide. So really, it's at the heart of all the collaboratives that we do, our QI collaboratives, is community, and really looking at how can we create spaces where NICUs learn from each other, they support each other, and actively raise the standards of care statewide. So here are some opportunities for you to get involved with our Improvement Palooza, the CARE Collaborative, and there's also opportunities with PQIP, which I'll share in a minute. Next slide. Nominations are now open for our 2026 Quality Improvement Awards. So this is really a great opportunity for you to nominate either individuals or teams within these 4 different categories that really are rising up and are stars around quality improvement. You can see our winners this year, Dr. Mindy Morris, and then the transport team over at Packard. So they have done great work and were recognized this past year in Improvement Palooza. And we'd love to see one of you highlighted and, you know, I guess, be able to share the successes you've had around quality improvement and then recognize in a beautiful way. Next slide. Here are a couple of new CPQCC tools. Beyond collaboratives, we continue to develop tools to support you guys. This primary care for the preterm infants and children toolkit, we just developed a video that highlights that toolkit. Oftentimes we've heard that this can be included in discharge notes for the pediatrician and for primary care outside when patients are discharged. So being able to like have a script and support, there's a tip sheet with that. Really, it's a wonderful tool for primary care to be able to take advantage of. Another up and coming soon is our neonatal disaster preparedness toolkit. We're really looking at supporting our NICUs in, you know, in casualties, whether it's fires or otherwise. There's a tip sheet there. This will be released in the next week and we'll do a blast out to everybody. But these are done and reviewed by volunteers. So I just want to highlight these amazing volunteers that make these tools happen. And we will, you know, continue to spread and develop. And if you have ideas for us, please let us know. Next slide. Here are some opportunities are coming up to get involved. We've got this wonderful webinar happening around addressing perinatal intimate partner violence. And you can see the QR code there and go ahead and share this with your staff, your colleagues. And then the Neosphere Conference, which is kind of a part 2. They did this last year with CPQCC, Dr. Jochen Prophet. Family members are a part of that as well. So great opportunities to get involved and, you know, level up your knowledge around different areas. So thank you. Next slide. So really, as we look ahead, I want to invite you to consider joining our perinatal quality improvement panel, which is truly the heart of our improvement community. Your expertise, your perspectives, and your voice are critical to shaping the future of neonatal improvement in California. So get involved. There's many subcommittees that you can get involved in. Any questions, reach out to me. I see many subcommittees members' names on the list right now that are attending this webinar, and talk to them, reach out. But really, truly, we'd love to have you involved. Next slide.
Great. Thank you, Courtney.
Yep.
Appreciate all the information that you shared about the wonderful work, the important activities, and most of all, the valuable people who are behind CPQCC's quality improvement. So thank you again. So we know most of you on the call today are current members, and we appreciate you for joining. But if your NICU is not a current member of CPQCC, or you have a NICU in your region, or a partnership, a system, a NICU in your system that's not a member, please visit our website or scan the QR code for more information. And you can see that here on this slide. Next slide. And if you're curious about the process of joining, we have this new member journey flowchart that gives you important details on what you will receive, what needs to be completed to be a member, and you can download this directly from the webpage that was shown on the previous slide. Next slide. So for our existing membership, we wanted to remind you that membership dues went out last Monday and on September 22nd. And what you're looking at is a screenshot of the letter that was sent out to the contacts listed on your contact report. So if your team did not receive them, your invoice or this letter, please create a help desk ticket and our team will assist you with that. Next slide. Okay, so now we're in our Q&A session. So folks can send in any additional questions or comments that you have, and we'll do our best to answer them. I don't see any as of yet, but if you have any, feel free to put them in. In the meantime, while I'm waiting, why don't we go to the next slide? If any of you have any conflicts and need to get out of here, let me just get you some reminders before we close out. So if you do have to drop off, thank you again for attending today's webinar. We're gonna just wrap up with these few reminders before we let you all go. Once you've logged off from the webinar, you should see a page with the survey link for today's event. But for your convenience, we do have a QR code to I believe it's to the left here on the slide. And you can click on that, or you should see it once you log off, and we can send it to you afterwards if somehow you miss it. Please, we would love to get your feedback. These webinars are for you, so any feedback that you give us, we will apply to webinars going forward. CEUs will be sent out at the end of all the sessions for live session attendees only, and we'll be sharing all the recordings and materials at the end of the sessions as well. Next slide. Okay, so our next session coming up on Wednesday, October 15th is about NICU data, presented by the NICU Data Center team. So to get most out of the upcoming webinars, we do recommend that you have access to NICU data and NICU reports and HRIF so that you can really maximize your participation. So if you need help logging onto any of those platforms, again, please send us a message through our help desk system, and then we'll assist you as needed. If you haven't done so already, please use the QR code to register for the rest of the webinars, and we look forward to seeing you again. Okay, next slide. Okay, so I'm not seeing any Q&A, so thank you again for joining us today. We appreciate you spending your afternoon with us, and we look forward to seeing you again. Bye, everybody.